joining. Allow me to begin our meeting for today with the permission of the presenter. Our meeting for today is on an overview of the family planning in Kenya and family planning services training curriculum. So I will not break the ice. I will prefer the presenter for today, that is none other than Dr. Mungoma. Dr. Mungoma is the Dean School of Pharmacy at Mount Kenya University. He is also the chair, he's also a national executive member and the chair for the education committee. So ladies and gentlemen, without further much ado, allow me to welcome our senior respected member, Dr. Michael Mungoma. Daktari, good evening.
Good evening, everybody. Good evening, Bao. Thank you for this opportunity. I want to welcome everybody joining in to our series of webinars on family planning provision and community pharmacies and just reproductive health in general. At this point, I also want to welcome the new pharmacists. I'm sure usually in these forums, there are people attending for the first time. This is part of the CPDs that we provide as a society, and you're most welcome. So I'm just going to start sharing my screen, and Bao, you can just confirm that the screen is visible.
It's perfectly well, Daktari, it is visible.
Thank you. So today we want to have a discussion about the general overview of pharmacy professional family planning training curriculum. As was mentioned, my name is Dr. Michael Mungoma. I'm the Dean School of Pharmacy. I'm also the chair of the Education Committee, but I'm also aware that there's a transition that is ongoing following the elections at PSK. However, I'm still part of that committee. And I will just start with a little bit of background of where we are coming from and what our role is as pharmacists. So the Federation, the International Pharmaceutical Federation, FiP, which is a global body representing over 4 million pharmacists, says or reminds us that the role of the pharmacist as an is essential to deliver primary healthcare globally, and as such, ensure progression towards UHC. So UHC is a very important component of achieving health goals that we're going to see both nationally and internationally. And the pharmacist plays a very central role in ensuring that this is achieved. So FiP uses evidence-based competency frameworks that support development of practitioners to deliver specific professional services, mainly within the pharmacy workforce, and focuses on their practice on areas such as medicines, use, review, adherence, optimization, compounding, prescribing, vaccinating, or managing communicable and non-communicable diseases. So this again reminds us that as pharmacists, we play a greater role. Sometimes we forget that we were not only trained to sit behind the counter and receive prescriptions and dispense medicines. That is not to say that that is a very important job. That is a very, very important job that requires a high level of qualification and skills as well as competencies. However, our scope is slightly wider, and we need to make sure that we exploit this space or really discover ourselves a bit more. So FiP again talks about support, the development and training of service-led competencies through short courses, certifications, and other CPD opportunities. PSK is very keen on the CPDs and creating opportunities for short courses and working together with other like-minded bodies in the healthcare environment, or other, similar-minded bodies, to expand the opportunities for pharmacists. So FiP has 5 developmental goals that are relevant to our discussion this evening. That is competency development, advancing integrated services, and which is something that is very, very important now, integrating services so that the community pharmacy or your pharmacy is able to provide a comprehensive service over and beyond products, so that the focus now is that the patient or the client is able to get more than just what money can buy in terms of what is there in the brown bag. The other FiP development goal focus is working with others, so a multidisciplinary approach, and being able to synergize or complement others and allow other people also to complement us. Then 9 is access to medicines, devices, and services. So that is the website there for FiP. It's important that as pharmacists, we are able to look at some of these resources. FiP is particularly admirable, I must say, because it is fed by very many competent persons, very many competent pharmacists, and they keep updating based on research as well as experience. So you should be able to visit that website and be able to appreciate the FiP development goals and just see where we're going. So the FiP Community Pharmacy section is particularly important because there are certain updates there that are affecting us directly. They have a Vision 2020-2025, pharmacies at the heart of our communities, at the heart of our communities. And there's a focus on essential pharmacy care. And the word that we need to look at very keenly here is administer. So that has come out very, very clearly. And administer is described as introduction to a human being, whether orally, by injection, or by introduction into the body, in any way or external application, whether by direct contact with the body of a medicinal product. So this is just an excerpt from what is there from FiP. And what we need to take note here is the injection as well as introduction into the body in any other way, meaning that as pharmacists, we need to be able to upskill and be able to upgrade the services. You're well aware that most of the products or services that we give would normally be products where patients would normally take them at home or at their own convenience. But we're saying here that over and above just dispensing, we need to be capable. We need to be capable and competent to administer and provide these other services and products. Still under that FiP Community Pharmacy section, it further elaborates the full scope. And part of that full scope description says that pharmacies can provide therapies requiring intramuscular or subcutaneous administration. So that's very, very important. Everything we picked up from school, all those theoretical knowledge as well as the practicals that perform probably on animals and so on and so forth, we should be able now to apply because we are well skilled to provide these services as well as use some of these devices to administer very, very essential medicines to our clients, patients. So it further says that any jurisdictions that does not empower pharmacists to administer medicines to the full scope of practice is endangering their population's health. I find this a very, very serious statement. And again, it obliges us now to make sure that we are up to, we are up to speed in empowering ourselves. So endangering the population's health and wasting a valuable resource in achieving better patient care and outcome. I'm happy to say that in our jurisdiction, we are well supported, and we'll be seeing in subsequent presentations or webinars that the government, Ministry of Health, Pharmacy and Poisons Board supports our endeavors in providing, in this case, injectable contraceptives, especially the subcutaneous one, which is part of self-care that we need to promote. So the pharmacist training curriculum, or the pharmacist training package that is out there, is known as Expanding Access and Choice to Family Planning Services in Kenya. So it's expanding access and choice to family planning services in Kenya. This is a package for training pharmacists and pharmaceutical technologists on provision of quality integrated family planning services. So there's a focus on quality and ensuring that we give the right product, or we are able to counsel the client or the patient so that they get the right choice of contraception. And then integrated family planning services. And we're going to get in further detail in subsequent, again, webinars, where we're able to work with other healthcare worker providers and have referral facilities that we know and fully understand, whether it's clinics, whether it's hospitals, or other healthcare providers, so that we have an integrated family planning service right in our premise. So why was this curriculum developed in the first place? So a bit of background there. Family planning is a central pillar of Kenya's reproductive health program and the wider national health priorities as outlined Vision 2030. So there are several reference points. The Kenya Health Sector Policy and Population Policy for National Development, 2012. And that government also appreciates and understands the importance of equipping pharmacists, with up-to-date knowledge and skills in order for them to provide quality planning services to clients seeking information and services from them. So they've realized that this is one sector where, again, this is a reminder for those who already know, and it's important for the new pharmacists or upcoming young pharmacists, that community pharmacies are quite central and are usually the first point of call for many. They go there for inquiries, they go there for clarification, they go there to demystify myths. And usually when as regards reproductive health and contraceptive choices, there's quite a lot of myths that surround that. And part of it is attributed to culture, religion, and certain traditions. So it's important that being at that point of service, that you're well equipped to provide quality family planning services to the client seeking information and services. So this training or this course, what you'd be able to gain at the end of the training is, one, knowledge on the overview of family planning in Kenya, so that you have a very wide understanding of where the country is and where the country is going. This touches on the national economy and planning. Knowledge on the basic anatomy and physiology of the female reproductive system, as well as the male reproductive system. So again, just reminding ourselves. Thirdly, skills and competencies in counseling for family planning methods. And this is a very, very important competency to gain, because as we're going to see later, there's a difference between counseling and advising. And counseling ideally, allows clients and patients to talk and express themselves and guide their choice, so that it is something that at the end of the day, the client makes a very, very informed choice. Skills and competencies in infection prevention and control, practices for family planning, STIs being one of the focus, as well as just the skills and competencies in IPC as regards the pharmacies providing choices such as injectable contraceptives. And then skills and competencies in short-acting family planning methods, knowledge on long-acting reversible contraceptives. So again, here, there's a clear distinction. It is knowledge, not necessarily skills. And this is tied to integrating services. Yeah, we can also do so much to a certain extent because our facility may be limited, as well as other legal requirements. So knowledge of long-acting reversible contraceptives, where you can explain to patients, advise them, and also address any concerns of clients who are already on long-acting reversible contraceptives and require information probably on ADRs or other side effects. Then 7, skills and competencies in post-pregnancy family planning, which is very important. 8, knowledge on voluntary surgical contraception. Skills and competencies in opportunities for integration of family planning services, meaning you need to know exactly where you probably want to refer the client to or what exactly the client needs. 10, knowledge on pharmacovigilance, which is a very, very important component even right now, just to ensure that products that are there in the market meet expectations and that we understand reporting systems, and we also understand bodies that can assist pharmacists as well as the client or the patient when something goes wrong. 11, skills and competencies in documentation, record keeping, monitoring, and evaluation of family planning commodity management. Remember, part of this training and the accreditation of this training was because the Ministry of Health or government purposely is looking for data, yeah, as regards access and use of contraceptives or access to family planning services, and community pharmacies being a first point of call for people in the community. The government really is keen on knowing how many people are seeking and what they're seeking. This is important for planning. So the training also allows for pharmacists to be able to report to the wider DHIS. So who was the curriculum developed for? It was developed for the 2 cadres, pharmacists and pharmaceutical technologists. And these are those that are working in community pharmacies, ideally. However, it is not limited to those working in private practice. It is also available for those working in the public sector. Because like I said, we need to increase our scope and our ability to provide these products and services when required, as well as counsel and advise clients who are already on these products and services wherever we are. Of course, there are eligibility criteria when it comes to determining who can be trained, as well as who is going to provide these services, but we're going to look at those details a bit later. As I mentioned earlier, we're just having an overview of the curriculum and family planning in Kenya. So this curriculum was developed through consultations facilitated by the Ministry of Health, PSK, KPA, UNFPA, and all these organizations, PPP, county governments, and various pharmaceutical companies. I apologize if I missed out on any other contributors. And they started as early as 2018, 2019, through a draft, a proposal and a draft with the Ministry of Health, and PSK was involved through the former CEO, Dr. Daniela. And eventually PSK became one very important implementing partner. And we had a series of progressive meetings to develop content. And then at the end of the development of the draft curriculum, we were able to test the curriculum. This was done to a cohort of pharmacists, as well as there were other cadres in that test that also included nurses from various counties in Nakuru. And we were able, this curriculum was accepted and validated. We're going to see a little bit later. So how is the training being rolled out? I'll just give a snapshot of the methodology for delivery of the training content. So there's a pre-test and a pre-skills assessment. So what happens is that you're tested before you get into the training. And they also check your skills before you get into the training, just to see at what level you are. I know we have gone through this in campus, and it is only when you get to the actual training, because this training is ideally tailored to practice. Then there are lectures, brainstorming, group works, role play sessions, case studies, scenarios, and simulations. Practice on humanistic models. Then there's a clinical practicum that is usually 2 days in a health facility that is identified, where people can have adequate experience under supervision. There's also a practicum that is normally done during the training session, and this is a 1-day in-house sort of practicum lab, where all the practical skills are administered, and we'll use models to either inject. We can also use scenarios where people can do simulation and a bit of drama. And then the use of log forms. So there are logs there that are going to be used to assess trained pharmacists. And these logs have tables that are going to be filled for every procedure or every administration of contraceptive methods that you're going to do in a facility. Then there's the post-test and post-training skills assessment. So after the training, again, you're tested and your skills are assessed. After that, certification upon fulfillment of course requirements. And certification here is done by the Ministry of Health, which will then allow you to be a certified family planning service provider at your retail pharmacy. So just a little update on what we've done so far. So the pharmacists from Nairobi County trained to provide family planning services in community pharmacies. This was a 5-day intensive workshop, including theoretical and practical sessions. So this was completed, led to a 2-day field experience in selected public facilities in Nakuru County. And here we were able to experience real life clients and counsel them, provide choices, including screening of the clients, which is a very, very important experience. Because the screening of the clients also includes screening for cervical cancer or counseling for screening, as well as screening for STIs. Then trainees were able to counsel, administer oral contraceptives, administer injectable contraceptive, and refer clients. So the experience of referral, again, is a very, very important one. It's well structured, especially when it comes to the county hospitals. There are very, very specific documents that one fills and refers clients to either higher level hospital and so on. So an overview of the curriculum. So the training package is intended to serve as a resource and guide to pharmaceutical personnel in both public and private sectors. Yeah? So including retail pharmacies in the provision of family planning services. It consists of a trainer's manual, a participant's manual, and a participant's logbook. So 3 important documents. And that each topic that is covered, the manual begins by presenting a brief introduction that is followed by objectives of the units. And then other areas covered include specific information of the topic, instructions on group work units, step-by-step instructions on how to perform various procedures, including illustrations, so that it's very, very easy to follow. And some of these can be performed on humanistic models and on clients, links to videos used by the trainers or guest speakers, and suggested reading or additional reading material. So it's quite rich and robust in terms of its ability to impart knowledge and skills. Remember, again, we have a cohort of trained TOTs who will be there to offer this training. So an overview of the curriculum, again, these are some of the topics that are found in that curriculum. One is introduction to the course, overview of family planning in Kenya, basic anatomy and physiology, counseling for family planning. Number 5, medical eligibility criteria for family planning, which is a very, very key and central topic because it allows you as the family planning provider to maneuver unique situations. Yeah, it allows you to make the best guidance, give the best guidance, and make the best choices in situations, for example, where there are comorbidities or where people are taking other medications for other purposes and wish to get a contraceptive choice. Then infection prevention and control, contraceptive methods, family planning methods, integration and referrals, documentation, reporting, monitoring, and evaluation, and 11, reproductive health commodity management and pharmacovigilance. So as a summary, this is a skill-based training course. Yeah. So the focus is to acquire practical skills, not just gathering knowledge. So acquisition of practical skills, it's clearly a learning methodology that will be required to deliver in the delivery of quality family planning services and other preventive health related services. Screening for HIV and other STIs, and being able to counsel and determine other problems or situations the clients might be facing. And a typical example would be, for example, coercion or people who probably had unwanted pregnancies and giving advice to them. Ultimate goal is to expand access and choice of family planning services and HIV preventive services through integration in pharmaceutical outlets. And then importantly, as I said, reporting or provision of family planning services to the DHIS so that these can be tracked and that we have a very, very clear picture of what the situation is on the ground as regards family planning services and access to contraceptives. So I want to acknowledge the Ministry of Health, Division of Reproductive and Maternal Health, in collaboration with the Pharmacy and Poisons Board, PSK, KPA, that developed this training package for provision of quality integrated family planning services in Kenya. Again, with support from Advanced Family Planning, JPIGO. Those are just some of the references that contributed towards this presentation. And I want to leave you with that quote. Thank you. Back to you, Mbao.
Asante sana, Dr. Mungoma. Thank you very much for the elaborate and probably the great introduction into an overview of family planning, of what has been going and where we are headed to. Probably to alert our members, is this for us to be able to take over provide some of these services in our various community services, and even at the hospital level. Such trainings will be important for us. And once you see the call is out, kindly ensure that click and you become available for such kind of trainings. This is because this is the only chances whereby when this training is offered, that's how we are able to best gain some of these skills. So probably allow me to look for any questions in between these. Let me see, there's one question on it.
Yeah, maybe as you're looking at the questions, I just want to say that we are really eager to recruit more persons to be trained. I think we'll be sending out more information very soon. I know we've had quite a bit of activities in the last few months at PSK, but hopefully that's going to settle at the end of February. And then after that, we should communicate or share a program of planned activities that include also the training. I also want to inform you that we are in the process of coming up with a digitized program, taking into consideration that most pharmacies, especially in community pharmacies, can be quite busy. And this will just offer maybe a bit of flexibility. But this is still in its primordial stages. Hopefully, by mid this year, we should be able to make some advances towards accessing a digitized training. Back to you, Mbao.
Asante, Dr. Mungoma. So probably, I see no questions. Probably any question? Let me see, I can see a hand up. For the questions, kindly ensure that you post your questions on the Q&A section. Kindly post the questions on the Q&A section for any questions. Probably also to alert you, we are going to have a pharma supply chain discussion and conference on the 9th and 10th of March. We are at advanced stages with various partners on how best we're able to host the conversation on supply chain. And probably to alert you, our members, is that this is not just a conference. This is more of a conversation. We want to have a conversation on the solutions to pharma supply chain. Supply chain, and probably this is to allow during this conference. It's going to be a 2-day half-day conference. A 2-day half-day conference. The 9th and 10th of
Mbao, we are losing you. I think you're moving away from the microphone.
Okay. It's going to be on the 9th and 10th of March at Strathmore Business School. Ensure that you register and please purpose to come physically so that we are able to get to know how best we get solutions in pharma supply chain. So Dr. Dr. Mungoma, there's a question from Dr. Joseph Esekon, and he's a member from Turkana, senior member from Turkana. Can you respond to his question, Dr. And probably shows much interest in the family planning supply chain.
Thank you, Mbao. I think I've seen some two questions. One about how much is the training and how can we enroll? I think I want to ask Joseph to just be a little bit patient. I think we'll provide more details by the end of this month or probably beginning of March. What we've had so far is training that has been facilitated by partners, and that those that are interested have not been making any payment. So we are hoping that we are going to be able to continue getting support from partners so that more and more pharmacists are able to access this important training. I've also, I think there's something there about who is eligible. I think it came in and disappeared. So maybe just to move forward a little bit, we have an eligibility criteria, and part of the information there is that the people that we want to be trained, one, have to be, of course, registered pharmacists and working in a registered premise or licensed premise. Two, that the premise has a space to allow for provision of these family planning services. So that's very, very important, so that we don't have people again just dishing out this product over the counter. And remember that we are going to equip you with skills to provide even injectable contraceptives. So it should be quite ideal. And then the other thing is that you should be able to avail yourself of the training throughout the training, because sometimes we get trainees and then they come for 2 days and then they disappear because of other commitments, which is understandable. But at the same time, I think having developed this training curriculum, we are very, very keen on ensuring that you are trained during the 5 days without interruption, and that you go out for the 2 days on site at the health facility, and you go through the pre-test as well as the post-test before we issue out a logbook for you to go back to your facility and practice. As regards the PPP portal, I think Mbao, maybe you can respond to the PPP portal and availability.
Okay, Dr. On that, I have seen also the one senior respected member, Dr. Joseph from Turkana County, had said that he even subscribed to this. So for members, let me check on the PPP portal. It is supposed on the portal. It's supposed to be there just as the topic appears on the poster in our WhatsApp message. Overview of family planning. It is there. Just look at it on the portal. You're going to find it there. So probably I will also share again on the WhatsApp messages. Kindly keep a close eye on the WhatsApp messages. But also, as Dr. Mungoma said, this is just a beginning of other various trainings. So our main aim is not just for CPDs. So let us look out for the trainings. As we proceed, we are going to be able to have more than enough CPDs. I'm certain that Dr. Jayesh, last year, if you never had above 80 CPDs, then you are supposed to get more than 80 CPDs. But just as a confirmation, it was uploaded, and I'll be able to check it and ensure that it is going to be there on the PPP portal, probably by end of today. So, ladies and gentlemen, without further much ado, let me welcome none other than one of our great members who has gone over and above to ensure that he ensures that we as pharmacists get this training on family planning. And he has the organization has recognized the important role of pharmacists in family planning and the supply chain of products, health products and technologies in family planning. Let me welcome none other than Dr. Johnson Anyona to probably give us an overview and a brief of why we are here today. Daktari, karibu sana.
Thank you, Dr. Mbau Gitau. Good evening, ladies and gentlemen and fellow colleagues. My name is Johnson Anyona. I am a pharmacist and a supply chain advisor. I work for InSupply Health. InSupply Health is partnering with Kemri, University of California and San Francisco, together with the pharmacy associations, that is PSK and KPA, to conduct an implementation research that is aimed to strengthen the pharmacy provision of contraceptives in Kenya. So overall, the question that we are trying to answer is that, can pharmacists offer quality contraceptive services through the community channel, and do they find it profitable? So those are the main research questions that we are trying to answer. And part of the activities that we have along the implementation of this project or this research is to also create awareness through this series of webinars, the first one starting off today, amongst the professions in the colleague, in the sector on family planning. I think the time is rife for pharmacists to step up and step in beyond the pills and condoms that we've traditionally been offering in the pharmacy channel, but also get the skills necessary to provide other methods that they are approved to do so, which we will learn as time goes by. But the policy environment is enabling, and the time is ripe for pharmacists to really make a niche in contraceptive services, because as we all know, the pharmacy or the community pharmacy is the first point of contact for many Kenyans who are seeking health services in general, but also family planning to be specific. So we are very excited to partner with PSK to offer this series of webinars that is aimed at increasing knowledge, creating awareness, and basically setting the ball rolling for the pharmacy sector, the community pharmacy sector, to offer contraceptive services, quality contraceptive services far and wide within our borders. So it is a great pleasure to partner with PSK, both from the in-supply side and also as a pharmacist myself. And I am hoping that the members will also take keen interest in offering these services professionally and expand their knowledge in contraceptives throughout the period that we'll be partnering together. So thank you very much, ladies and gentlemen, and I'll hand it back to Mbau.
Asante, Dr. Johnson, and probably to appreciate the work that Dr. Johnson and Dr. Mungoma are doing behind the scenes to ensure that pharmacists are recognized as family planning, to administer family planning services. I have our PSK treasurer to probably give her vote of thanks and closing remarks for the evening today. Dr. Achoka.
Thank you so much, Dr. Mbau, for giving me this opportunity. I just want to thank each and every one of you for joining us for this session. I'd especially like to thank our presenters, Dr. Mungoma and Dr. Anyona. We have a very good opportunity and a big platform for us to enter into expanding our practice to just do well and do good for the community. At the end of the day, we want to ensure that all our patients are safe and they receive all the medication that they need well and from qualified professionals. And we are those qualified professionals. So thank you so much for taking the time. Thank you so much for being here with us today evening. Back to you, Mbau.
Asante, Madam Treasurer, Honorable Treasurer at Pharmaceutical Society of Kenya. Ladies and gentlemen, our seniors, senior respected members of the Pharmaceutical Society of Kenya, esteemed members of the Pharmaceutical Society of Kenya, and honorable fellows of the Pharmaceutical Society of Kenya, Nasema mara mingi kwamba lililo na mwanzo lazima liwe na mwisho. Tumefika tamati wa somo letu la leo. Tunatumai kuwa na masomo mengine kwa muda ujao. We're going to be having more of these trainings in time to come. And look out on these on our social media sites, on our WhatsApp, on our emails and SMSs. I will assure you today I've probably sent you more than 5 SMSs. Also look out on the Pharma Supply Chain Conference. Come, let us discuss solutions. Let us give solutions. Remember, there's nobody else who can give solutions in the pharma supply chain. And there's no other person to talk about the supply chain of health products and technologies rather than we, the pharmacists. Come physically at the Strasbourg Business School, register and also register online. Sina mengi ila kuwaaga, alamsiki.
Thank you, everybody.
Thank you.
Goodbye.
Thank you, everyone.
Good evening, everyone. Bye.